Thank you, everyone, for waiting. I just want to give everybody a bit of an update of where we are. I'm going to begin by giving you sort of a local summary and then sort of what's going on provincially. Really not much has changed since last week. We are still, experiencing at this point a decrease in all of our parameters, which is good. I'm just going to highlight here some of the pertinent data that we're having, and I'm sharing my screen right now. Jenna, I want to make sure that you see it.
Yes, we see it. Thank you.
Thank you. So in terms of our hospitalizations, you can see that we're down. We're down to 7 hospitalizations and 1 in the ICU. And if we look at the sort of the course of it, you can see here that this is the total number of patients admitted to all our hospitals, including the 2 in Ottawa, since over the last 2 months or so. And these are the ones that tested positive. And then you could see the more pertinent one, which is who actually was admitted for COVID, not just happened to be positive. You can see that we've had drastic numbers go down. And right now we're at 7 and 1. And provincially, this is reflected. And you could see we have 7 hospitalized right now and about 15 total with positive. So about 50% of our cases right now in hospital are due to COVID, and the other 50% just happen to be testing positive for COVID. So that number is going down, and so it gives us a good idea of where we are in terms of community-wide transmission. Again, one of the indicators that we're looking at. Of course, the other indicators that we're looking at is positivity, and again, that is going down in the right direction, and you can see it's kind of hovering there. It's going to go a bit lower. This is a 7-day average, and I know that our day-to-day goes down, so that will be reflected in a couple of days as we sort of go back the 7-day period. But again, it is going down. You can see we're up to 30%. And again, some areas are higher, some areas are lower in our area, but again, it's on the way down, and that we're seeing provincially as well. And again, the other important measure that we're looking at are outbreaks. And again, right now we've got 7 outbreaks, and you can see, again, the trajectory is downward, which is, again, a good sign. And again, peaking sometime in the 2nd, 3rd week of January here, 46. Now we're down to about 7 outbreaks. And again, this is all going in the right direction. And finally, in terms of our wastewater, this is going in the right direction as well. Last week, we were kind of seeing a bit of an uptick in the Hawkesbury number, which is here, the orange one. But you can see now over the last week or so, you got a downward trend, not only from Hawkesbury, but you're seeing it downward in Castleman and in Cornwall. So again, these are good measures, and I'd like to see it as low as possible. And this again gives us an indication, regardless of testing and testing numbers, where we are. So all these taken together into the context of looking at the overall trends are going in the right direction and continue to go in the right direction. And this, despite our opening of January 31st and the more recent opening that we did on last Thursday, which is not a week yet, so it's hard to tell. But again, despite some of our openings, we're going there. And I think one of the things that is really protecting us is the fact that we have a high, and particularly the number of hospitalizations going down, particularly I think has to do with the number of vaccinated people we have. Like in our area, if you're looking at 12 plus, we're in the 90% range, both first and second dose. And if we're looking at some of our third doses, we're about 58%, 58.6%. And as you'll see in our next slide here, that it's much higher among the elderly. And again, this is something that we need to really strike home with, because we need to get the third dose into the elderly. As you know, we've already given a 4th dose to the elderly individuals in congregate care settings. At some point, we're going to be likely giving a 4th dose to everybody, perhaps starting with the elderly, because we know that their vaccine wanes. In other words, the vaccine efficacy goes down with time, particularly the older you get. And so then again, here we are with over 91% with our 80 plus, 88% with our 70 plus. And 78% of our 60 plus, and about 57% of our 50 to 59. Interestingly, across the province, what we're seeing is for 70 plus, third dose is about 86.6. The 50 to 69-year-olds, sort of overall, that swath is about 57%, and the 18 to 49s are about 42%. So again, I'm happy to see that these numbers are going up, but I would like to see the gray go up as much as the blue and orange at all across all these lines. Of course, we also know that we're just starting to deliver third doses to 12 to 17-year-olds, and I think the latest statistics show that I have it somewhere here that where were we? Yes, we've administered about 30,000 doses, and that provincially is about 5%. In our area, it's about 1.9%, but then that's going to go up. So I do expect that to go up significantly, and that's going to add to our third dose coverage, and I'm hoping that these others go up as well. The 5 to 11-year-olds were again sort of plateauing at the 50% mark, and we're about the 22% for second dose. And again, we encourage people to go and get vaccinated as soon as they can. And so, all this to say really that we are headed in the right direction. We're on track right now, as far as I'm concerned. And by the way, in terms of schools, over the last week, we've had 4 schools that reported absenteeism of more than 30%, 2 of which were due to bad weather. And so only 2 out of our over 125 schools in our area had some significant absenteeism. I'm sensing from our school boards that they're seeing that there's less absenteeism going on. So again, all of that, what we see in schools, what we see in institutions, in congregate care settings is a reflection of what's going on around them. So we know that those numbers are going down in terms of community transmission, community levels. They're not down, they're not zero. They'll never get zero. There'll be ups and downs as we move forward. But again, as I've said many times, our goal is to make sure we vaccinate a third dose as high as possible, fourth dose when required, likely in the fall, continue working with our high-risk partners, continue working with our schools, and then continue looking at using antivirals. We have a mechanism in place where we'll be able to give antiviral medications to people that are high risk for complications. So that too is going to decrease the burden of severe disease and protect the vulnerable at the same time. So with all these things in place, as you know, we are now slated to go into sort of full opening in terms of no capacity limits next week, actually a week yesterday, March 1st. At which time the passports will also be removed, the passport requirement. Now, despite that, I still think people, however, the passport requirement does still persist federally for travel in Canada on train or planes. And so I think that's another incentive. But again, despite the fact that the vaccine passports have been removed, for the general public, I still encourage you to get your first, second, or third dose. And if you are hesitating, get your third dose. Please get your third dose. It'll increase your personal protection against getting the infection, against Omicron specifically, and it'll increase even more your protection against being hospitalized. I'm not going to show it again, but I keep showing it all the time. The graph, it's very clear that the rates of hospitalization among the vaccinated versus the unvaccinated are much higher, both in terms of hospitalization, ICU admissions, and death. And so the vaccines do their job. They're there to do their job, protect our healthcare system, protect our vulnerable, and then we will then look at what happens post March 1st. Obviously, the masks will remain in place, and that's something that's going to be reevaluated on a regular basis, looking at school precautions as well. Slowly, some of the precautions are being removed in school. Kids can do extracurricular activities, interscholastic, those type of things. Masks don't have to be worn outdoors. And so progressively, we'll be removing masks as well. Both publicly and in schools, but not at this point. I think it's prudent to be able to just say, okay, we'll go to March 1st, we'll evaluate it and then see what happens after that in terms of what else we're going to remove. I know that Quebec, and I probably will get the question, Quebec, I've already got it from other media. Quebec has announced that they will be removing masks from classrooms. But after their spring break, which is now, I think now, so as of next week. However, I think that our approach here just to wait and see once we open everything up and then reevaluate it. And so so I do agree with that approach. So Jenna, I'm ready to take some questions.
Thank you, Dr. Paul. Merci. There are no questions in the chat box. If anyone has questions, please unmute yourself now. Il n'y a pas de questions dans la boîte de clavardage. S'il y a des questions, vous êtes invité à ouvrir votre microphone. No questions for today, Dr. Paul.
Okay, merci. Bye-bye tout le monde. Thank you.